About the state of health now. We've been looking at several different areas when it comes to service delivery in South Africa. Let's focus on the health sector now, and we're joined by Dr Lwazi Manzi, Health Minister's spokesperson. Thanks for your time, we appreciate it. So, we have instances in South Africa where people are still complaining about poor health services, especially when it comes to rural areas. What's taking so long to actually get this right?
So the minister that has come in came in and signed a health compact with a whole bunch of stakeholders, and this was led by the president, of course, known as the Presidential Health Compact. Now, this compact is the commitment of government to ensure that where we have been lagging behind and where there has been slowness, that there's now acceleration of improved service delivery. It is also combined with the quality improvement plan, which is also there to ensure that we actually accelerate in the improvement of quality health care as we deliver our services. The other thing, of course, that is going to be particularly helpful for us is the advent of 4R technology to ensure that we actually leapfrog where we may have been left behind, and that is getting a lot of careful attention at the moment, and also there's a lot of resources that are going to be pumped into that. So we can actually look forward to an accelerated, quality, improved service delivery in healthcare in this country from now on.
From now on, but we've been waiting, and it's 2020. It's a bit long, isn't it?
No, I would say I would actually disagree that there's been a slowness or there's been a regression. We have seen a lot of programs that have actually done really, really well. If we look, for example, at our the largest program in the world, of ARV program, we actually are one of the leading countries that is starting to reach its 90 goals. We expect that we will be able to reach those goals by the end of 2020, and we are looking at being able to reach those the goal of 95, which will mean that we actually have control of the epidemic by 2030, and that has in fact increased the lifespan in the past 10 years.
But you can't escape the realities of things like babies dying in hospitals in Tembisa, long lines still in public hospitals across the country, not just at one hospital. How do you fix the attitude of healthcare workers then?
In regards to babies dying, if you actually look at Statistics South Africa, you'll actually see that our infant mortality rate, our under 5 mortality rate, and our maternal mortality rate has dropped significantly in the past 7 years. So we have actually seen improvement in those health indicators. If you look at malnutrition,
that's no comfort for a mother who's lost her child.
Yes, we'll get to that. But what I'm saying is that we are looking on scale at a huge improvement in our health indicators. All our health indicators have actually improved drastically. Now, in regard to hospital staff and their attitude, of course we do need to work on that. A lot of that has to do with staff being overburdened, of course, and having to take care of much larger populations than we've been expected to have to take care of. We have a large population growth. We also have a huge influx that is putting pressure on our system. But as I said, with the plans that have been put in place, the health compact, the quality improvement plans, these are things that are addressing all of the other socio-economic factors that are feeding into the pressurizing of our system.